So far, we have reviewed the issues and impacts of challenges that face patient access that impact cash flow. Now let's talk about how to get that cash back into the hospital piggy bank. First, if you don't have one already, create a policy that all patients having inpatient and outpatient care must provide a government-issued ID. This small policy can have a big impact to deter people trying to commit identity theft. Also, it can help with selecting the correct medical record if you have an image of that ID in the record. We already talked about the tremendous pressure registrars are under to register patients. So do what you can to embrace technology and show your leadership team how you have ideas to improve cash flow. I promise you, they will listen. Also, use a robust database to validate patient identity and addresses. Be sure it taps into numerous databases, not just one, that uses algorithms to authenticate the patient's identity and address. In the event the data reveals that you have a fraudster sitting right in front of you trying to get admitted for care, be sure you have clear policies in place so the registrars know what to do, whether it's follow a protocol or call a supervisor. Well, you've heard this before. The difference between activity and results, well, it's measurement. So start tracking the number and type of registered errors you get every month and compare month over month to identify any trends. Then work to improve those trends, preferably by using technology to help you. I hope these ideas were helpful. I'm sure some of you have heard these things before, but hopefully it was a good reminder for a few of you others. And at this time, I'd like to show you an effective, easy to install, and easy to use way of overcoming the challenges we've addressed today. It's called Patient ID Authentication from Sienna Register Healthcare. And here's how it works, at a very high level. First, the patient will provide the registrar with their driver's license. Then the registrar swipes the ID on a magnetic stripe 2D barcode reader that populates data into the ID, from the ID into an interface screen. Then the registrar confirms the accuracy of the ID with the patient. So, is this your correct address, things like that. Upon review approval, the registrar clicks a button and the patient's identity and address is authenticated by a HIPAA-compliant Verify ID web-based database. It's validating address, legal name, Social Security, date of birth, terrorist list, and healthcare fraud list. Lots of things here. And second, an easy-to-read report of the patient's identity is presented showing if they passed or failed. All right, well, let me show you this in a screenshot. This first one is the screen that after the registrar scans the driver's license, it populates this interface. Then, after the registrar speaks to the patient to see if there needs to be any clarification, she can update any field on this document, on this page. And then the registrar makes any changes and it submits to the Verify ID database. In seconds, the results are generated, and here the patient passed the inquiry. The registrar can then click on the Details button on the bottom right there to view the full report. Here's the full report, page 1 and 2 together. This report shows how the identity is not associated with somebody deceased or a minor, and the Social Security number was issued at the correct time of birth. This report will also provide an OFAC result, which is from the Office of Foreign Assets Control of the U.S. Department of Treasury administers. The OFAC database also validates that the patient isn't part of a terrorist group, international narcotics traffickers, or other threats to national security. But typically the registrar would not need to open the report since in this case the patient passed. However, if the identity failed, then the registrar would see this, failed. And the report would identify where that identity check failed. In this example, the ID match failed because the address was incorrect and the correct address is provided. So upon approval of the data, all you need to do is press a button and this data that you see on the screen can be pushed into any HIS or ADT system or pretty much any intake screen that you want to use. And it can also do it to multiple systems simultaneously. You know, here at Scan and Register, we believe it's extremely important to use numerous data sources to validate a patient's identity. If you only use one source, such as the credit bureau files, you're not getting a complete picture of the person, and it can be embarrassing if the data is not correct. By using the numerous sources as listed here, you can be confident that the result is accurate. If the patient identity has failed, there's a good reason for it. Plus, we take it to another level and bounce their names against OFAC lists, and also a database that defines the people who have committed any sort of healthcare fraud with any kind of government agency as well. So in summary, our customers have told us that the following issues are ones that they seek to improve, and our patient ID authentication solution can help improve these challenges. The ID authentication solution will improve registration accuracy, authenticate patient identity, deter insurance fraud, provide better patient classification, and reduce write-offs. We're close to wrapping up here, and I wanted to take a moment to say that we believe, and I'm sure you do too, how important it is for hospitals to seek to improve the quality of care while striving to save time and money. No healthcare provider can survive if we don't keep an eye out for the bottom line and find solutions to help cash flow. Every hospital is different, and every department within the hospital has its own strengths and weaknesses. And while there is no magic pill to resolve bad debt, I'd like you to think about the issues and see if our patient authentication solution could solve any of your challenges.
All right, and at this point, we'd like to pause and take some time for questions and answers. So again, please go ahead and use the Q&A panel on the right side of your WebEx screen. If you are not seeing that panel, you may need to press the blue return arrow button on your WebEx widget, and that should bring up the panel for you. So again, use the Q&A section. All right, we have one question so far. Let's go ahead and read this. The question is, can you scan insurance cards as well as driver's licenses? Tanya?
Oh, okay, that's a great question. Yes, we can scan those cards, but we just have to make sure that that payer, you know, the insurance plan, that they actually have either a two-dimensional code like a PDF 417 or a magnetic stripe that's already on it. So once we can read that information, we can populate any kind of interface. But just know that most payers don't do it at this point in time. So if we created that for you, it would only be for a portion of those payers today.
Great. Thank you, Sonia. Go ahead, ask any other questions you have. All right. Looks like we've got another one here. It says, can this be used internally on our clinical staff? It would be nice to know if any of them are on the healthcare fraud list.
Okay. Yeah, we've heard this before, and yes, we can absolutely do this. Basically, the user that's going to be performing analysis on the clinical staff, they would need a unique login, and probably be faster to do it more in a batch mode than it would be the way we do it today in this example, which would be one at a time with each patient. So we can certainly accommodate that. So thanks for asking.
All right. I'll give us another moment or so here to see if any more questions come in. Okay. Can you scan an image of the insurance card if it does not have the mag stripe or the barcode with your clinical scan cap? Is that
Yes, we can absolutely do that with it's a different application. So with SmartRisk Clinical Enterprise, we do have a picture capture feature where we can capture it and then it goes into, we can send that picture into the electronic medical record or any way that you need that to go.
Great, thank you.
Welcome.
All right. Any further questions for Sonia while we have her here? All right, Sonia, I don't see any more. So.
All right. Well, thanks, everyone. You know, and I really want to thank you for taking the time today to be with us and to learn more. We certainly look forward to seeing you again and working with you. So I'd like to go ahead and offer my email address here. Feel free to contact me directly, and I can answer any of your questions and, you know, help you figure anything out. But thanks so much.